Hello, I'm Dr. SudeepKoshy Kurien, Interventional Cardiologist. After diagnosing coronary artery disease with an angiogram, how do we proceed? If there are too many blocks, long blocks in very critical areas of the vessel, and a diabetic with long-standing diabetes, then sometimes you'll have to go for coronary artery bypass surgery, where you connect a graft from either from the leg or from the internal mammary artery to the distal part of the vessel, and thus bypass the block. If there are other blocks which can be removed by angioplasty, most of the blocks can be removed by angioplasty nowadays. What you do is you pass a guiding catheter through the radial artery or the femoral artery, and you hook the coronary artery, where you need to do the angioplasty, pass a wire across the lesion, and then do a balloon angioplasty. Put a balloon and compress that lesion and open it up or make it bigger, and then remove it, and then later put a stent there, and stent is mounted on a balloon, and then you inflate the stent and keep it there as a scaffold and deflate the balloon and take it back. So this is how we do a coronary angioplasty. This is fairly a simple process if it is a simple angioplasty. There are other mechanisms to make it easier if there is calcium, like rotablation, where you put a diamond burr and ablate the lesion. There are also newer techniques which are used to remove the blocks which are very difficult to remove otherwise. After removing the block, you put the stent again, as mentioned earlier. So this is how we do a coronary angioplasty. In case of primary angioplasty, this is an angioplasty done as an emergency after heart attack, where there is acute blockage of one of the major vessels, acute sudden blockage. So here there might be a lot of clot burden, there might be a lot of clots also. So you again pass the wire through the catheter, cross that lesion, and then sometimes you may, if there's clot burden is very high, you may have to suck the clot out using a device, and then do an angioplasty using stents, as I mentioned earlier. So this is a life-saving process, which if done early will save not only the lives but also muscle, because time is muscle.